Hi guys, Brian here from City Back Pain Program. So in this video I'm going to look at 5 truths to dealing with lower back pain successfully. So these are the 5 most important points I think you need to consider if your goal is to be able to successfully manage lower back pain for the long term and to obviously build a more robust, stronger, pain-free lower back. Okay, point number 1, which is the most important, I think, for kind of shaping, sort of how you approach, a successful, plan to deal with lower back pain. There's quite a famous quote from Professor Stuart McGill. There is no such thing as non-specific back pain. There is always a cause. So what he means by this is that back pain isn't some mysterious entity that you've been cursed with that just kind of comes in and takes over your life and there's nothing you can do about it, and all the best you can do is just kind of manage the good days with the bad days. What he means is, and his approach, which I think is very effective, is to look at it from a mechanical point of view. So for example, if you've got disc bulges or herniations, or like a vague term like disc degeneration going on in maybe 1 or 2 or even 3 of your discs, but all your other discs are fine, there's a reason why that disc or those discs are getting worn out. So there must be a reason why in the movements that you do day to day, in your posture habits, there's a reason why those discs are wearing out, and you're kind of putting them through more use than anything else in the rest of your back. So if you can start to understand it from that point of view, it actually becomes quite empowering. So I think one of the worst things, especially when I was doing my lower back sort of 4 or 5 years ago, is you feel completely helpless because you don't really understand what's caused the problem, and therefore you haven't really got a clear understanding of what you need to do to get yourself out of trouble, to keep the back pain-free for the long term. So always bear in mind, McGill says there's always a cause to your back pain, and one of the sort of the fundamental things you need to do is by looking at the kind of damage you've got to your discs, or the kind of pain you've got, or the sort of movements that tend to cause you pain. It's going to give you big clues as to why you've got your back pain, and kind of a starting point for the sort of things that you need to maybe avoid to kind of let the back start to settle. So again, very important. It's not like a big vague entity in your life. There's always a specific reason why you've got back pain, and your key point, really a starting point, is to work out why, and then from there you can work out the how as to get yourself out of trouble. Point number 2, stealing from Dr. Andrew Locke in Melbourne now. So he's got a great quote. Back pain is not forever, but the exercise is. So what he means by that is that your back pain you don't have to be in back pain if you don't want to be. However, there are certain things you need to do to keep that back stronger, more robust, more tuned, so you keep it out of trouble, so it's not always on that knife edge, sort of ready to sort of jam up and cripple you. So you don't have to accept back pain day to day, but what you do have to accept is you are going to have to do some work and then maintain that work going forward to keep the back happy. I like to look at it's a bit like brushing and flossing your teeth. You don't have to do it, but if you get toothache, there's going to be a problem. So if you do a bit of preventative work, keep the back happy, keep it tuned, then you're not going to have those bad days where you can barely move, and keep being that cycle where you have kind of good days and then it kind of flares up for a while and it settles. So if you're proactive with it and you don't get lazy with it, you can indeed have a pain-free lower back, but you do have to do some work and keep doing that work going forward. Point number 3, so disc bulges and herniations will heal provided you take out the movements and posture habits that have created them in the first place. So that's probably one of your key starting points, kind of following on from the point number 1, which is Stuart McGill's quote. Once you understand the movements and postures that have created that extra wear and tear in those discs and that giving you that pain in the lower back, you need to remove and modify your movement and posture habits so that you stop doing any more damage and also let the back start to settle. If you do that successfully, your actual bulges and herniations, what happens is the body will harden them and kind of gristle them, and then it will start to nibble away at them. So that's a very key point. A lot of people think that once you've got a disc bulge or herniation, you're on the sort of the path into oblivion. There's nothing you can do. However, if you understand it from a mechanical point of view, what has caused that damage, and you stop doing those things that's caused that damage, those disc bulges and herniations will actually heal, and your back will start to settle. So that's one of the most fundamental things you need to do at the very start, is identify those movement patterns, take them out, and let the back start to recover. Once it starts to recover a little bit, then we can start thinking about building this, doing the exercises and the exercise plan that you need to do to create that kind of spinal stability and keep that back protected for the long term. Point number 4, your success in rehabilitating your back and creating or building a stronger, more robust, pain-free lower back is depending upon using an exercise program that is appropriate to your injury, spares the back and so it doesn't cause any more problems for you, and is also challenging and progressive enough that you can start to build some more robustness into the lower back. So when we do any exercise or any exercise program, we've basically got 3 outcomes. So if we've done everything right at the right time in the right way, you're going to get a good result. So the back's going to start to feel stronger and more robust. The pain's going to start to settle. If we've got a little bit, something's not quite right, you're going to get sort of no effect, which you'd notice after sort of a couple of weeks or so. The back still doesn't feel like it's getting any stronger. It's still a bit on that knife edge and it's not quite right. Or even worse, if we've got something wrong. So it could be the wrong exercise, it could be the technique's a little bit faulty, or it could just be the right exercise at the wrong time for you. So it's a little bit too much, a little bit too challenging, and it just kind of fatigues the back a bit too much. Then things are going to get worse. So most people, when they go to the gym, the way they usually approach it is, have a bit of back pain. They kind of get through the acute stages after sort of 5 or 6 weeks, starts to settle down, right? Into the gym, get myself, fit and conditioned for life. But then the sort of the techniques and the exercises they use either ingrain the muscular imbalances they've already got and put the back at more risk, or just the technique they use tends to wear out the back and put the back at risk. Or it could be just that they go too hard too soon and just fatigue the back too much and then put it back in that kind of danger zone where it's going to flare up again. So the tricky bit with dealing with back pain, yes, there are common injury patterns, definitely certain exercises that everyone needs to be able to do well to keep the back happy. The tricky bit is knowing which exercises to start people off on and when. And for each person it's a little bit different, so it's kind of dependent on their injury, maybe how active they were before they had the injury, what sort of, how sort of aware they are of how their body moves. A lot of people don't tend to move very well, so you can't give them, complicated programs to do initially until they've learned that basic control. But most importantly, with a good program is going to be adaptive as you progress. So it's going to start you off in, not too challenging, but not going to be too easy too. But then as the back starts to respond, the program can change and modify and adapt to keep progressing you and kind of keep pushing you towards building that back stronger and more robust. Point number 5 is to be aware of your bank balance. So this is probably the best analogy I've come across for kind of get you into the right mindset for looking after your back long term. Is to think of your capacity for your back to do work during the day or during a gym or maybe during sport as a bank balance. So when you're on that kind of knife edge where it's going to you sneeze, it's going to just light up like a Christmas tree and kind of, you'll be on the floor curled up in the fetal position. You've got a very low bank balance. So say, for example, just to get through a regular day at work with the family, whatever it may be, without having a lower back pain episode, just for easy sake, we'll say you need $100. So when you're in that acute stage of back pain and it's all really angry, it's all kind of, the hips and the back are all kind of fighting with themselves, you might have only got $20. So, just getting out of bed in the morning is going to take $5 of that. Just sort of walking around, every time you sit with poor posture, you're going to make a little withdrawal on it. Every time that you bend with bad technique, you're going to make another withdrawal. And kind of your goal is, especially in the initial stages when it's very acute, you've got to spare that bank balance as much as possible so that the next day you'll get a little bit of interest. So maybe today you've only got $20 and the back's very angry. You can barely get through a day as long as you're careful what you're doing. But then maybe the next day, because you've let it settle a little bit, you maybe got $25. and then 30, and then maybe 40, and it starts to grow. So once you understand mechanically what's caused your back pain and what's sensitizing your back to pain, you take those movements and postures out, and the back starts to settle, that bank balance starts to grow, a little bit of interest. The more we've got in that bank balance, the more that we can start to take out and invest in a suitable rehabilitation program to help get the back a little bit stronger. Because even the best people in the world, some of the rehab exercises do take a little bit of that bank balance out, just so that the next day the back can get a little bit stronger. But long term, the successful plan, what you're looking to do is spare that bank balance as much as possible and then grow it as much as you can. So say, for example, you need $100 to get through the day pain-free, but then you want to get back into lifting weights or training or running or maybe cycling, then maybe you need $150 bank balance every day to keep your back safe. So you've got enough to get through the day, but then we've got a bit of a safety buffer left at the end of the day for anything unexpected. Then maybe after that, maybe you want to get back into sort of competitive sport or maybe team sport. Perhaps you need more like $200. Or maybe you want to get back into lifting really heavy and want to be able to squat 300 kilos on your back. Perhaps you need $400 to get through your day and get through your training and have the back flare up in an episode. But that should be your key long term, is wherever you are now, so if you say you're in pain, that back balance is very low, how do you spare what you've got left in there at the moment and start to let it grow with interest? And then what exercises and routines do you need to use to kind of invest with some of that back balance and let it grow even more and more and more? And the goal is that long term, you want to build that back as strong, as robust as possible, and build that bank balance as big as possible and maintain it as big as possible. So you've got a nice safety buffer. So whatever you need to do to get for your day and training and sport that you want to do, you've got that extra safety buffer just for unexpected things in life. And that's the key to keeping the back happy. And you'll know long term that if you get your back good and it's going well, and you start to get lazy with either things that the exercises you should be doing that you haven't done, or maybe the bad habits have started to creep back in again, you'll know when that back balance starts to drop again, because there'll be little yellow flags, like the back will just start to tell you it's not quite happy. Maybe the upper body will be a bit stiff, or maybe one side of the back will get a bit tight, or maybe the hips will get a bit tight. It'll just start to tell you, just to remind you, hey, we need to build that bank balance up again. So long term, look after your bank balance, and that's the key to keeping your back pain-free and keeping it robust and strong enough long term, and being able to manage it for the rest of your life. So there we go. Those are the 5 important truths, or 5 most important points I think you need to consider if you want to have success with managing and reducing back pain for the long term. All very important, but like I say, most important thing is probably point number 1 from Stuart McGill. It's not this mysterious entity that's entered your life. Understand it from a mechanical perspective, and then from there it starts to give you, sort of empowers you, and then you know what you need to do to kind of get on the right track to build that back, to make it stronger, more robust and pain-free. So if you need some help and you're struggling with your own back pain watching this video, you want some expert help to kind of get you on track, I run 2 session locations, one in Bondi Junction and one in the CBD of Sydney. So get in touch if you're struggling with back pain and sick of having it dictate life. Get in touch with me and we'll get you in track. I offer a 360-minute consultation to everyone that comes in, so we can sit down, look at any scans or x-rays you've got, have a look at, chat to you about your history of your back pain, what you think it might have caused it, what rehab you've tried before, what has worked, what hasn't, and then we can get you on the right track to building a stronger, more robust and pain-free lower back.